Here we go. Morning, Mr. Dalrymple.
Morning, morning.
Your entry into physiotherapy, what took you there, and basically your background.
Right. Um, Basically, my entry into physiotherapy came through sports and my love for sports. Um,
Mhm.
I can try to make this story as short as possible, but when I when I was younger, I used to play a lot of cricket. I thought I was pretty good at it, um, and I wanted to pursue it as a career. Right. To be
Mhm.
honest, I wanted to pursue it as a career. However, along the lines, the powers that be um, insisted that I had an education and not throw all my eggs in the sports basket,
Right.
right? Which by the way, was a fantastic decision.
Mhm.
I must say. Of course, at the time, it didn't seem that way, and so I started to look at professions that I thought would keep me as close to the sport as possible, and
Okay.
physiotherapy was one of them. And honestly, that's how I learned about physiotherapy, 'cause from seeing the guys running onto the field in football games, knowing of the physios that work with cricket teams and what's not, and in the different sports, and that's where I kind of saw myself at that point, um, being heavily involved in sports, just simply out of my love for sports. Then one of the prerequisites to getting into the program is to do your volunteer hours. So when I did my volunteer hours at the QEH, that exposed me to actual physiotherapy.
Mhm.
So it was there that I learned about the different aspects of physical therapy, physio, physical. I guess we'll get into defining those two if there's a difference just now. But that actually got me into physiotherapy, and when I realized how dynamic the field was and how widespread it was, and it was not just isolated to sports and sporting injuries. I I I I fell in love with it. I was like, yeah, this is my thing. And I don't have to focus on one area. I can express myself in different areas of the field, and the rest, as they say, is history.
But that's fantastic. So you can imagine that you went from disappointment, being that the powers that be deemed that education was the way to go rather than plowing away,
Yeah,
spending
yeah,
all
yeah,
those hours in the sun, in on the fields. But
yeah,
no,
man.
it actually steered you in the direction that you have come to really love and appreciate.
Yeah, exactly. And a funny story that I can give you real quick.
Hmm.
Myself and one of my close friends, we had a discussion a time back because I was feeling a little bit discouraged about not being able to play cricket at a level that I thought I was capable of. And
Right.
I was telling him that I gave up a lot for cricket because I gave up an opportunity to go to national volleyball trials to play cricket. I stopped swimming to play cricket. I stopped karate to play cricket. I stopped tennis to play cricket. And because cricket took up basically a whole Saturday, and then you had to train during the week after school. And I was saying I just can't believe that I gave up all this and got nothing. But ironically, I got a fantastic opportunity to work with sports, with cricket, to go to a regional Super 50, to fortunately be part of the winning team. And I mean, it was fantastic. So, yeah, I really can't say I have any regrets.
Man, that is brilliant. But I know I see it in the gym, moving fairly athletic and thing. But I didn't know that you had all of these strings, volleyball, tennis,
Yeah.
karate. I didn't know that you had all that going on, face.
Yeah,
But
I got a black
that's
belt,
good.
man. Don't mess with me.
Man, I live and rap on them. But I think that's a really good lesson, though, Fizz. I can hear, in speeches in the future, speaking to the young ones and letting them know, you know what, at the end of the day, when one door closes, there's another opportunity just staring in the face and something, though, that you can actually then
Yeah,
really
always.
take into your own and perfect. So that's really good. That's
Always,
really good.
always.
So you spoke about the difference between physical and physiotherapy a little bit.
Mhm.
So can you elaborate on that?
Yeah, I could elaborate very quickly. There's absolutely no difference. They're
Mm-hmm.
they're one and the same. Some schools of thought will tell you that the physical therapists use more manual techniques, while the physios use more exercise-based techniques. But
Right.
in general, there's really no difference. Yeah,
Mm-hmm.
there's really
Mm-hmm.
no difference in the two. We use them interchangeably.
Okay. Okay, great.
Yeah, man.
So GOBW67 is saying Black Belt Queen, which is destined to be one of your new nicknames. Big it yourself. Dance is saying Campo Days, and the girl Tammy Bigger say, look at you
Kempo
with the
days,
hands
yeah,
in the
man.
air. Elite Ford said every time workout mate. Kachina, no, land. She said, oh, whoa. So that's really good. I really like that story that you can definitely tell to the young ones later on.
For
So as we
sure.
delve a little bit further now, let me speak about the role. Because you said about
Mm.
this the sporting aspect, which is what really got you into to looking into physiotherapy. But then you also spoke about the more diverse nature of physiotherapy. So we can tell me a little bit about that.
Right. So basically what physios do and who physios are and our role is to help people, right, who might be affected by injury, illness, or disability as well. All right.
Mm-hmm.
And we do this, we help them through movement and exercise, as well as a variety of manual techniques that we use. We also play and should play a key role in educating the public, and that's an area that I think sometimes we fall short in. But
But you're here now doing it.
yeah, exactly. I was just about to say it, but I'm glad for this opportunity to, try to do my part to help correct it. But yeah, we educate and advise as well. So it's basically about helping people, helping the injured, the ill, those with disabilities, and we do it through movement, through manual techniques, through exercise, educate, right? And education, I think, is a very important part of our job. Um, and we basically help maintain health for persons of all ages, literally from the cradle to the grave, literally. And yeah, we help with pain management. People know that about us a lot. We help with pain management. And we can also help in the prevention of diseases like these NCDs. Um, and I think that's what physio really is all about in a nutshell. The ability to help people, through the methods that we use.
So not only we speaking about the actual physical medicine after you've been diagnosed, we
Mhm.
also speaking about the maintenance in that regard. So we have the phase where we're getting better. We have the phase where we're maintaining. And you talking about the phase of preventative medicine as well, man?
Indeed, indeed, indeed,
All
indeed. And
right.
I think education plays a big part in that first
Mhm.
phase, of prevention. And it's always said that prevention is better than cure, and it really is. And I guess we
Mhm.
can touch on some stuff later down that will highlight that as well. But I mean, it really is about getting the message out there that we need to move and keep moving, and yeah, I know you are the movement boss, Skirt,
No, no,
but
no, no,
yeah,
no.
yeah,
That's one of them. That's one of them. That's one of them.
just one of them, yeah,
Yeah.
yeah. We really need to get that message out there. So again, it's really great to have these kind of platforms to do it.
I really love that you spoke about that entire gambit there because a lot of the times when we speak about physiotherapy, a lot of persons may look at it as, oh, shoot, well, I get hurt, my hand mash up. What are you gonna do? Call Ghostbusters? No, sorry, go to the physiotherapist. But the preventative aspect, though, as you correctly said, that is very, very important, and get that education out there
Indeed.
so important. So we can delve a little bit into that education side of things a little bit because I really intrigued about the aspect of some of the items that we would not necessarily think about that
Oh yes.
physiotherapists would not, right?
Yeah,
So
boy.
I will give you that entire stage here now to deal with.
Yeah, boy. We could do a whole live on that one alone.
Aye.
But yeah, man. But yeah. So we are so much more than just the stereotypical you know, massage and ice pack maybe. You know, we do so much more than that. We are so much more than just, you know, massage. You know,
We
and
come in
massage
talk,
is,
you know.
yeah, massage is a word I really didn't want to use here because it kind of gets under our skin as physios somewhat, where, you know, we people just think of us as just giving massages, you know. And no
I
disrespect to the masseuse or the massage therapist at all, but you know, our profession is so much more. So yeah, we do comprehensive examinations and assessments, you know, for our patients and our clients, and we evaluate these findings. You know, we formulate diagnoses, and you know, we consult with different areas and different expertise. So like Dr. Drake's and the others, you know, we consult with all of them on patient care and what's not. And we implement treatment plans, of course. So again, so much more than just massage. But to touch directly into some of the areas that people really wouldn't think about physio in, pediatrics is one of them. Um, and to touch a little bit on pediatrics, actually today I was telling my colleague Mia that that's a really boring part, but it really isn't, to be fair. And pediatrics is for you. So there are a lot of things you could do literally from the time you were born, because there's some injuries that you sustain at birth, right? So you can have your Erb's palsies, your your um your your Erb's, your cystic fibrosis, scoliosis in children, um, a whole heap of stuff. And there are physios here. In case we didn't know that, in case you didn't know that work specifically in those areas. Um, those guys work with the Children Development Center, and they do a fantastic job with the children. You know, cerebral palsy, developmental delays, all of those things physiotherapists help with in pediatrics, right?
Yeah.
Another area, unless you want me to say a little bit more on peds, but
Man, you just really piqued my interest there, to be honest. You
yeah,
really
man,
did.
ask away,
Well,
ask away.
I got a number of questions. I actually think that this is something that we could probably delve into a little bit later.
All right, cool. So I'll just give you the others that I can
Mm,
think of off the top of my head. Well, not off the top, because I got my cues here to help me remember to stay on track. But
okay.
pediatrics, women's health is another one.
Mm-hmm.
And women's health uh, entails stuff like pelvic floor dysfunction,
Mm-hmm.
pelvic pain in general, osteoporosis, which is something that affects females a lot. Um, there are things like prenatal and postnatal care. So your Lamaze before walking you through and taking you through the stages of what you should and could expect. Just let me stick a pin here. No, Denisa.
Mm-hmm.
But prenatal and postnatal care, that's what physios do. So with women's health, that falls under that purview. We do some lymphedema as well. And now that I mention lymphedema, I'll also mention,
You gotta explain that one.
no problem. But as I mention it, let me just mention that a lot of these areas overlap, right? So don't think of it as one specific area, but a lot of them overlap.
Okay.
Lymphedema is where we help to to drain and channel fluid that has built up. So if you have damaged lymph nodes, usually post-surgical, and we see it a lot in cancer patients. And oncology is another area of physical therapy, right? So oncology is another specialty, and oncology is in dealing with cancers and what's not, any effects that result from that. So lymphedema instead will help in clearing those channels, clearing those drainage pathways, right? So that the lymph nodes and the system can get back to functioning as it should. Um, Outside of women's health, we have geriatrics, which you know is a is a bit of a spot for me as well. I really
Yes.
believe, yeah, I really believe in active aging, and I think physios have a big role to play in the older population aging actively. I think we have long passed the time where you should retire and stay at home on your couch.
Facts.
I think, yeah, I think that we need to to change that dynamic in society, and I think it's a
Absolutely.
cultural thing, and cultural things take a bit of time to change. But I think that physios need to, get out there and start, putting that foot forward as well in the area of geriatrics. But yeah, we work with the elderly, and the elderly is a specific population because there are a lot of different circumstances and injuries and ailments that affect the elderly differently
Right.
to how they would affect you and I, right? So simple things like balance, meaning that you get to spend the last 20 years of your life walking as opposed to wheelchair bound because we came in and showed you how to balance going upstairs, you know?
Aye.
So you didn't slip, you didn't fall, you didn't break the hip and never walked again. So at
Perfect.
95, you could still get up and walk. At 100, you could walk to the door and open it and invite the governor general in. And that's another area that we're involved in, geriatrics. Another one is cardiopulmonary, which is cardio, heart, pulmonary, lungs. So heart and lung, work of
Mhm.
breathing, that sort of thing. So we work in this one will happen mostly in acute settings, such as hospitals, where you have patients who are bedridden, who are ventilated at times, who are even sedated at times. And we start our physio intervention from then, right? And it helps to maintain function so that when they're off sedation and they're able to orient themselves in place and time and follow instructions, it's a little bit easier moving forward to get them to sit up in bed and stand up and take steps and walk, right? Because if you've been ventilated for a while, trust me, things that seem as simple as sitting up in bed become difficult, right?
Right.
So that's another area we are involved in, and in that cardiopulmonary area also involves cardiac care. So the heart attacks, the pneumonias, the bronchitis, the bronchiectasis, the whole range of lung conditions, COPD, asthma,
Mm.
all of those areas we have a hand in as well. And I know we can talk a little bit later about physios and COVID, so I will
Mhm.
save a little bit of that for then. All right?
Okay.
Yeah, I'll save a little bit of that that cardiopulmonary
Okay.
stuff for then.
I see that Dr.
Neuro,
Sandra
uh-huh.
Ball is already there. You know,
Yeah,
she's
yeah,
in,
yeah, very much
especially
so.
during
We
COVID.
we play a very important role in COVID. Research has proven it that we play a very important role in COVID and in keeping those mortality rates down, and as well as getting persons back to full function after COVID, right?
Okay.
Well, after they've been off vent, let's say they were on vent and what's not, even in reintegrating them into society because there are long lasting effects from COVID sometimes, something called long COVID, that's
Yeah.
LONG. So, um, yeah, but we'll touch on that a bit later.
Yeah, man.
Neuro.
So before you touch
Oh,
the
you.
next point,
All right. Mm-hmm.
your gas station is in here, presenting more nicknames. I ain't gonna repeat that though. Presenting more nicknames for you. Mia is in here. She says she's proud, Queen. I got big up Mia actually
Yeah.
because I
Thanks, Mia.
remember when I had two injuries and I was able to call Mia. I had an injury to my wrist. And I also had an injury to my chest, and I was able to call me and me. I had me sorrow in me 2 days. I was pain free. So I really
Yeah,
got big up.
man.
Yeah, I am very grateful to this day for that.
Karen, I can't not take this 2 seconds to say something about Mia because
All right, I ain't sure if it is Quinn that is stuck or if it's me that is stuck. I see a buffering sign. Okay, here we are. Here we are.
oh, we there? Are you still hearing me?
Yeah, I hear
Right.
you
Yeah.
now.
Yeah. 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 I was saying that I knew. me basically from the time I got in Jamaica, because she was there before me, and she kind of showed me the ropes then, and has basically had my back ever since. So
Mhm.
I gotta give big props to Mia. She has been there. But
But
yeah,
me walk out that you're ready for the spotlight, man. But yes, Quinn, the stage is yours again, my bro.
right. So um, neuro is another area of physical therapy that we well, another area in our specialty of physical therapy. And neuro is short for neurology, right? So you have your neurological conditions, which can be stuff like MS, multiple sclerosis, spinal cord injuries, that kind of thing. Um,
Right.
even stuff like fibromyalgia, um, neuropathy. Yes, sciatica is even considered a neuro problem, right? And so it's areas, neurology is areas involving the neurological system. Stroke is a big one. Stroke is a big one because that really affects it, and
Right.
that's one of the main ones here in Barbados. Stroke rehab, right? And we have physios here who specialize in stroke. So who specialize in stroke rehab, you know? So that's another important one. I touched on oncology earlier, which is, treatment of different types of cancer,
Mhm.
right? And the symptoms also associated with that. So cancer so a cancerous tumor can lead to, let's say, a neurological condition, because it can rest on a nerve. It can lead to muscle weakness, which is, basic or ortho, which is what a lot of people know us as and know us for. So oncology is another specialty in physiotherapy. And there are physios around the world who do a myriad of different things, right down to palliative care physios. Yeah, and obviously the ones that we know of are the ortho, which is the muscle injuries, the bone, muscle, tendons, tissues, and we know of sports, which is the one that I started off talking about. The action guys that run onto the field. Although that's not 1/3 of the story. Your work does not happen on the field for all of those like me who thought that was where it is.
Mhm.
Yeah,
Mhm.
and yeah, I actually see that when working with animals as well. There is a market for physiotherapy with respect to animals rehab.
Mhm.
Um, it's not a big one here in Barbados, but it is definitely out there. There are so many avenues, and that is one of the things that I love about this profession. I don't think you can get bored.
Wow. Absolutely diverse.
Yeah,
Work.
man.
I think that's something. I work with that's I actually saw recently where persons were working with dogs, cats, horses, just to name a few. But those are the
Yeah.
ones that I came across. Quinn, you mentioned about working with um, infants, young
hmm
children. I One of the things that immediately came to me is like how you know how easy, and I didn't know that that situation has to be very delicate. Like,
Uh,
to work with a little baby in a situation like that.
uh, to be honest, it can be challenging in ways, and it can be not so challenging in others. It's not one of my preferred areas to work, if I'm completely honest with you. But
That's fair.
working with, yeah, working with pediatrics can be a bit challenging because it's a little bit difficult for them to express themselves to you, um, especially the younger they are. So
Mhm.
if you get something like a herbs in a baby, a herbs palsy in a baby is it's a little bit difficult. But you need to trust your skills, and that's why as physios we train a lot and we study a lot, because you need to trust your skills and in circumstances like that. And as long as you as long as you know what you're doing, as long as you trust your skills and you are competent, which all of our physiotherapists here in Barbados are, it actually doesn't become very, very difficult. And I must say that we are very creative here as well. So I've worked with a little guy with hip dysplasia. That was an injury of the hips, when he was born, when the little guy was born. He had a surgery to correct it, and I had to try to get him to use his hips again. Like, so if I'm talking to you, I can tell you that we're doing 3 sets of 10 reps of hip abduction, or hip flexion, and we work that way. But at 3 or 4 years old, that's a no. So
Right.
yeah, he actually had me running through. I was working at a hospital at that time. He actually had me running through the QEH department, playing tag to get him to use his hips and run, kicking a football
Nice.
to try to get him to engage in hip flexion, and a host of different stuff, pretending to kick me. And yeah, but it can be difficult, Kurt. It can be, but it doesn't have to be. And once you trust your skills as a clinician, and we've all studied enough, and we continue to do educational work in the field of physiotherapy, and with that, we know that we have the skills here to really manage any situation.
But the thing about it is, you mentioned that the situation in the field was not necessarily something dance. Was not necessarily something that you would choose out of the few. Your character suggests that you would be pretty much ideal to work with children as well, because you have the character to be able to get the best out of them.
I've been told that, okay? I've been told that. I, I don't know, man. I don't know. I've been told that, and to be honest, the ones I've treated, we've gotten along really well.
Hmm.
Um, and I've never really had serious issues with them. But yeah, it's not my preferred area.
And
I
that's
don't know,
reasonable.
man.
That's reasonable. So Mark Howell, aka Thor, is saying he had no idea how diverse the profession is.
Yeah, very
Melissa
much
is
so.
saying this is unbelievably educational. Trust me, it definitely is, because I am definitely learning a lot here as well. Um, Dawn, Barbados Glaucoma Week, says sounds like you can have a lot of fun. Okay,
Yeah,
it's
you
also
can. You can. Yeah, you can. Especially treating the peds can be a lot of fun.
yeah. Denise is saying when they pretend to kick you, but Melissa was quick to point out that you were at work. Yeah, but so we actually spoke a little bit about working within the pandemic.
Yeah.
Oh, by the way, I just want to say Danielle is saying I agree. He is great for that area. I think that anybody that know you in here, right? You could drop the comment. Anybody that know you in here could definitely say that you'd be great to work with. And not that you won't be great to work with anybody, that's the truth. But I really feel like you would go a special way with the children. Um,
Boy, I don't know. I might go rethink my career choices, man. My specialty areas and stuff.
but the beautiful thing is that it's so diverse, as you touched on there, just like you have
Exactly,
so
exactly.
much, and experiment with until you really find what you absolutely fall in love with, you
Yeah,
know.
man.
So we spoke about the pandemic, and we spoke
Hmm.
about how physiotherapists have now been working with persons to help them to deal with long COVID and help them to recover, not even if it ain't long COVID.
Hmm.
Um, so touch on that a little bit there for me, my bro.
Um, yeah, so COVID has literally, and I mean literally, changed the world. Um, it has turned a lot of our norms upside down, and that includes some of our citizens, some of the people, some of our patients, some of our clients. And in COVID specifically, we work in the acute setting as well as in the in a clinical setting up until discharge, and even then we continue to work. So basically, in the acute setting, and and it's been proven scientifically, as short a time as it's been with COVID, that early intervention by physios, and in some places you'll have your respiratory therapists who will do the work as well. It's been proven that early rehab has proven to work. You know, and that early rehab can be, you know, as simple as, so not as simple, as early as working with a patient who is ventilated and sedated, right? But before I touch on that, let me just give a little background into why a patient might be ventilated and sedated from COVID. Quick stuff.
Right.
So, as we know, COVID can affect the lungs. It doesn't have to, but it can. Some people are asymptomatic. Some people are mildly symptomatic. Some people are severe. And one of those mild to severe, and probably in more severe cases, is the effect that COVID has on the lungs, right?
Right.
So you might be wondering how a glorified flu can get you on a vent, right? But it's more than that, right? So COVID can affect your lungs, so it can cause inflammation of your lungs, right? Which leads to pneumonia, right? And I know people hear about pneumonia a lot, and I'm just going to tell you a little bit of what pneumonia is. So pneumonia is an infection of in your lungs, there are these small little air sacs, right? And those air sacs are where oxygen exchange occurs, right? So that's where your body gets its O2 and helps get rid of the carbon dioxide. So you need the oxygen to be in the blood, you know, to be healthy.
Yes,
And
sir.
if those air sacs get infected, right, it can make breathing a little bit difficult, and it can make oxygenation very difficult, meaning
Right.
oxygenating the blood, right? And that's why you get really ill with COVID, right? And that pneumonia is not the end of it. It can lead to something called acute respiratory distress syndrome, right? Which is where fluid is collected in your lungs. And if you think of your lungs as a balloon, if you pour fluid in a balloon, there's nowhere for air to go, right? So if you don't have air, if you don't have oxygen, oxygen cannot get to your vital organs. So then you get kidney failure, you get liver failure. And by the time you reach that stage, you're on a vent. And if you're not on one, you will be on one very, very shortly, right? So that's kind of how it progresses. And just let me throw a thing here for that being one of the reasons why we need to be really careful and stick to the protocols, even though that we've been given a little bit of freedom. But yeah, honing back in on physio, when that happens and you're ventilated and sedated, nothing works. So your muscles are, you know, down. And by the way, you use muscles to breathe as well, right? It doesn't just happen. You know, you use muscles to breathe. The intercostals, the diaphragm is a muscle. So you use your muscles to breathe. And in COVID, what can happen is that if you end up on a ventilator, which is a machine that breathes for you, and you're ventilated and sedated, our early intervention has been proven to help, right? And to help decrease the instances of mortalities, right? And that early intervention can be as simple as doing range of motion exercises, meaning that you lie down and we come in and move your elbows so that you don't get stiff, because you don't want to be off the vent and, you know, can't raise a shoulder, can't bend an elbow, can't move a wrist, can't hold a pen, you know? So you don't want that to happen. So we intervene there, and we also intervene in the cardiopulmonary aspect of it, meaning the chest aspect. So sometimes what we can do and what we will do is something called suctioning, if it's indicated. And suctioning really is just trying to get the secretions, what you would call, you know, when you got the cold what you call a sputum that you bring up, right? I call it, we just call it secretions. Get those secretions off the chest, right? And if it's indicated, we'll suction to get them off. We'll use other breathing techniques as well to get them off. So they're breathing techniques that we can use even when you're ventilated and sedated, which don't require you to actively participate, right? And that is the scope of physio. Such is the scope of physio, right? We have those specific skills that we can help you even in that state, right? And then, as I mentioned, there's the range of motion where you move the limbs, the legs, the hips, the knees, the joints, to stop them from seizing up, to stop them from getting disuse, arthritis in some cases, and for the muscles, disuse atrophy, where the muscles just waste away, right? Mm-hmm. And in that, so we move from there, and with the doctor's intervention, the respiratory therapist, the physiotherapist, and the grace of the Most High God, we get you off the vent eventually, and you come down to, by the way, you don't just pull out the vent and say breathe. There's a stage of weaning, Right. So you wean the person off the vent. And physios are vital in that aspect as well, because they help with your work of breathing. So that short of breath feeling that you have, they help to retrain your muscles of breathing, right? Mm-hmm. And that's the short of breath feelings that you may have in simply rolling from your back onto your side. Mm-hmm. So we then come in and we work with you, the patient, as well as with the medical team, using our techniques and our interventions to help with the breathing, the work of breathing, right? So to help with your breathing muscles. We move past that. So we helping to wean you off the vent. So you're off the ventilator, you no longer need oxygen. We're there again for mobility. So something as simple as I mentioned, sitting up. And by the way, once you're off sedation and alert enough, you can sit up and you can take steps even when you're on a ventilator, even when you're still ventilated, right? Mm-hmm. And that early mobility is what has been proven to help, right? That early, being able to mobilize that patient at the earliest possible time is what's proven to be helpful in COVID times and in treating COVID patients. That being said, of course, it means that you also have to know your ventilator. So you have to know your ventilator settings, and ventilators don't come with one wire attached to the patient. You may have a patient attached to 40 wires, but it means that you need to know that area as well, right? So those are just other things that physiotherapists have to know and other things that we do. So yeah, we're moving on from the vent. You're off vent, you're in the bed, maybe an oxygen mask, maybe not. We then help you to sit up. So you're sitting up, and we retrain your postural muscles. So we retrain your core, your back, all of those muscles that you use just to simply sit up, right? And we take it for granted, stuff that we take for granted. And I took it for granted for a long time too, until I had to work with them. Until I had to work with patients who literally could not sit up because they'd been sedated and ventilated for a month or more, right? And from there, you get into standing up, right? And that's a different act. And by the way, a key word for physiotherapists is function, right? Because what we do is try to retrain functional movement, right? It doesn't make sense if you can bend your elbow, Kurt, but you can't bring it to your mouth. Right. So you understand what I mean? So it's a functional movement. So stuff like rolling onto your side is a functional movement. Stuff that we take for granted, right? So then we go to standing. So we stand, we help to retrain those muscles. So now we introducing the legs, muscles in the legs. And remember, while you were ventilated and sedated, we were moving those legs every day to maintain this range and maintain some tone if we can, right? And so you're here and you're standing now. And then you walk, right? Then you walk. So it's another retraining there. And walking after a while, after being ventilated and sedated, can be tough on the cardiopulmonary system,
Can imagine
right?
that's a big muscles they use now.
Right. So we're there for that. We're there for that as well. And from there, so we get you up out the bed, we get you walking, we get you breathing on your own, no oxygen, no supplementary oxygen needed. Good to go, fit for discharge, through the door, never to see us again. No, wrong. We still there. So we now follow up with our outpatients. So you discharge, and we follow up with our outpatients. And this is all tied into COVID, right? Because the aim is to get you functioning in society again.
Right.
To get you as functional as possible. So we get you back to work. We follow up with you, and we find out. Of course, we would have known probably found out your profession from interacting with you, and then we can do things to kind of hone in on that area. So if you're a mason, I may not necessarily want you to just be doing a knee extension.
Mm-hmm.
You know what I mean? If you're a mason, I want you to be doing some overhead stuff. I want you to be able to, use your arms, and all of that falls under our purview as physiotherapists. And then we get into the long COVID, LONG COVID. Mm-hmm. And that's where people have symptoms for in excess of weeks, months. And I mean, it may be a little bit too early to say years in the grand scheme of COVID, but the way COVID has been, I would have put it past years coming into the equation at some point. But from what we know, you can have effects for weeks and sometimes months after, right? And it usually happens for the more severe COVID that you've had. But it doesn't mean that it only has to be if you were on a ventilator. You can suffer these effects sometimes even from mild to moderate cases of COVID-19. Right? So stuff like shortness of breath would be common and more prevalent. Sometimes chest pain, chest tightness, problems with your memory, problems with concentration, difficulty sleeping, heart palpitations, stuff like that. So COVID can linger in your system, and even though you've beat the COVID-19 virus and your test is negative, you haven't really beat it as yet, because you're not a functioning member of society. No, you can't walk up a flight of stairs without calling for the oxygen mask. So that's not a real function, right? And physios are important there again, because we then have to work with you to help to improve and increase your tolerance, your exercise tolerance, right? And then we hand over to guys like you, Kurt, who do a fantastic job as well in the area of specialty exercise and keeping people moving and all of that. And that's why physio is such a, is an area that crosses over paths with a lot of other areas. But yeah, just to stick it to COVID, all of those things we help and we work with, from simple strengthening of muscles that you use daily and that you will need daily, to chest pain, shortness of breath, helping to improve your work of breathing, or decrease the amount of work you have to do to breathe, to get you back to function, right? And I don't want to use the word normal, because we're not abnormal, but it's just an illness, right? And our job is to get you functioning again, right? And that's a large part of the role that we play during the COVID-19 pandemic in treating COVID patients. And if I could just also say that exercising and things like that help to boost your immune system. So if you do it before you catch COVID, it can help you decrease your chances of contracting the virus, right? And in addition to that, we have been on lockdown all over the world for sometimes
Ever.
months. Yeah, months. It feels like years sometimes. And exercise can help with psychological stuff as well. So stuff like depression, anxiety, stuff like that. So it is really all encompassing. Yeah, is and even in COVID, you can see where all the other areas of physical therapy come into play: cardiopulmonary, neurological, orthopedics. You can see where all of them tie in just with treating a COVID-19 patient. And we don't only have COVID-19 patients, because people still fall off ladders and break hands, and
Yeah.
people still get in accidents, right? So
Mhm.
it's just important. And if I can leave a major point and a take-home point, is to move. Just exercise. It does not have to be strenuous. Yes, it does not have to be strenuous. It doesn't have to be a near-death experience like myself every Tuesday, Thursday, and Saturdays. You know, it really doesn't have to be a near-death experience, but but it can be fun. It can be entertaining. It can be exciting. If you like to dance, dance. You know what I mean? If you like to tune in to the stand home party and walk up, walk up. If that's what it takes for you to exercise, do it. You know, but just move. That's the key. Just move. Exercise. It will help. Even short bouts, 5 minutes, 3 minutes, 3 to 5 minutes can help boost your immune system. And that might be enough to save you from COVID and to save you from having to see me every day for the next 3 months of your life. You know?
Mhm.
So
Mhm.
that's my take home message here. Just keep moving, keep exercising, keep working out, and it does not have to be tough. It doesn't have to be anything that you think is going to kill you, you know?
Mhm.
And yeah, man, I just really hope that's helped. Help to bring some light to what we do as physiotherapists and some light on the profession, on a whole. I know we probably gone over time, but
We am I don't think anybody in here minds the fact that we have gone over time, sir, because the information, wait, he has stuck. All right. Well, in any event, I'm sure that Flo will bring it back in shortly. The information that we have got this evening has been fantastic. I felt as though that I was in the classroom here, but really fascinated by what I was learning here, especially when you spoke about the entire aspect of dealing with COVID, helping persons to recover from COVID. That is massive. That's a lot. The entire process. I was really
yeah, man.
intrigued when you spoke about persons who are sedated. Are you still ensuring that they get that range of motion work? Because even
Yep,
though they are not voluntarily doing it, there is definitely a benefit to still moving around the joint, and that
very much
really, I
so.
mean, all of it there was fantastic, but that part really, really piqued my interest there, Quinn. There
Yeah,
were some
very much
comments
so.
in there. I can just pick out a few. Swimmer made a point. Swimmer sprint. He said he missed the beginning of the life, but from working as a PT in the US, he has seen some very interesting patient presentations post-COVID. Very peculiar. And I'm sure that
Yeah,
Quinn, in your continuous learning about dealing with this, because I imagine that you get information almost every day now, because
of
the
course. Yeah,
is a
especially
new
with
these
COVID,
days.
you gotta keep on top.
Yeah,
Yeah.
yeah.
I
So
mean,
I'm sure that you are hitting some places.
I don't see COVID patients daily. I don't think I've
Mhm.
ever seen one, but yeah, you
Mhm.
still gotta keep your knowledge base up. You don't know when it will happen.
You got that right. You got that right.
Yeah,
It
man.
could happen tomorrow. You never know. Based on
Exactly.
this conversation, it could even happen tomorrow. Dan spoke about the ergonomics and posture. I am assuming that was basically echoing what you were speaking there. Quinn, there's so much really that I would like to unpack from this conversation. I actually think that I may have
Yeah.
to ask you to come in for a part two, to be honest, because
No problem at all,
I got a
Kurt.
lot of questions.
Yeah. I am always happy to talk and to educate persons about my profession. and always happy to, get the professional, let people know what we do, let persons know that we are so much more than just a sprained wrist or, you know, a, a, a massage, so to speak. I'm always happy. So if you need a part few, a part three, a part a part 12, Kurt, you know where to find me. Um, I am I am always here, always available.
Well, I got a lot of appreciation for that. I'm glad that you were willing to come in here and spread your knowledge. And it's a lot that you were able to present today in a very, very, in a way that everybody could understand everything that you said, you know? Because, I mean, I just looking at your comments here. Cam decrypted, she has some clapping, the clapping emoji for the information that you were speaking. Stefan Dimas says, very informative. Mia says, fantastic job,
Yeah,
Uncle
sexy.
Keith. Another one of the nicknames. Don says, learned a lot. True Blue says, Uncle Queen, great job. Oh, you look like a fairly young man, and you know that you'll be represented as Uncle Queen.
Yeah, those
Cam
got some
decrypted.
babies.
Okay.
You see, y'all telling me
Cam
about these, but working with the peds. I got a few babies, man.
Well, there you go. Cam Decrypted says, definitely a great session. Melissa says, florally educational and so fascinating. Dan says, this is my physio and one half of my nuisance squad. Nuisance squad. Louise says, fantastic life. Danielle says, very informative. Great job, King. Melissa says, definitely need a part two. Again and again. Kurt, you free for Saturday? Well, I kind of got something lined up for Saturday already. That would be Dr. Drake's coming back for his part too. But most definitely, you're looking to get Kwayne back in as soon as possible. A lot of comments here. So my Sprint said he saw a COVID patient up to today who had a moderate case at the beginning of the month, and he is unable to stand and walk
It
even with a
happens.
walker. Wow, and
It
has
happens.
severe
It
muscle
happens
spasms.
really
Only
quickly.
started. Yeah,
It
and this
happens
only
really
started post
quickly.
COVID.
So yeah, you're asymptomatic with COVID. You are asymptomatic until you are not. And
Yeah, yeah, that tells
we
the
we
story.
we haven't, yeah, we haven't learned enough. COVID hasn't been around long enough for us to know everything about it. So it's always a kind of continuing spectrum of things with COVID specifically. But yeah, it can happen, and it does happen. And we gotta be prepared for stuff like that.
Well, you know what? Just like doctors who are looking at it every day, and we gotta continue to pray for the doctors looking at this thing every day, all the counselors
Indeed.
as well. We also gotta include the physios and everyone who's dealing with rehabilitation. Keep those in your prayers as well, because you can't be looking at a
Yeah.
man who was generally okay a few days ago, and then the next thing you know, this man is struggling to even stand. That
Yeah,
has to be
man.
very hard on the psyche. So we
Yeah.
gotta keep you guys in our prayers.
Or I just want to point out a word here for our physios at the QEH, because our QEH physios do a phenomenal job, to be honest. Um,
Hmm.
sometimes they get a lot of heat thrown at them, but
Hmm.
they do phenomenal work, and it's them. They are the ones who are on the front lines at Harrison Point, right? It's
Right.
it's it's all right for me to come and educate you about it from my living room, but we have physios on the front line, who are literally putting their lives on the line, to make that difference that I just educated you about. So, hats off to to our QEH physiotherapists as well. And really and truly, it's not. I didn't want this life to be about me. I wanted it to be about the profession, right? And from the feedback so far, I think that's definitely been the message. I think
Yeah.
that's definitely been the message. It's all about the profession and pushing this profession forward, and showing people and educating people as to what we do and what we can do.
Well, Kwayne, to be honest with you, I can say that you've done a fantastic job because you covered exactly what you wanted to achieve here. Spreading knowledge, you have done that. You will get a 10 out of 5 for that there right now because you did a fantastic job giving us the information. And then just me that everybody here saying it. Teach saying great job, Kwayne. Amir Django says that's the opening batsman from the Trinidad or Guyana. Django says favorite physio. Very
Blessings,
informative
Django.
from Howell Physio Barbados, giving you the hands clapping emojis. Pots Physio is in.
Yeah,
I
it's
know
always
they have
good.
a nice check as well.
Always good to get
So they're
ratings from
speaking
physios, man.
about
I'm glad.
yeah. They are speaking
Glad.
about being active during pregnancy. So I think that's a very interesting
Yeah, tune in.
life as well.
Tune
You
in.
know, so most definitely, guys, I want to thank all you for coming through. Quinn, I really want to thank you as well for spreading this
No
information,
problem
man.
at all, man.
Yeah,
Anytime,
been an
literally.
absolute blessing. We know we can get you back for a part few.
Part few,
Choose
as you
people
ready.
first is the hashtag. And
A little louder
yeah,
for the
thanks a
ones
lot,
in the back.
everybody. We went overtime, but you guys stayed with us all the way through. Fantastic information here, Queen. I just want to wish
Yeah.
everybody a fantastic night. Rest well. Have a fantastic Friday. You have one more day to go until the weekend, and
Yeah, man.
we will be back again on Saturday for another talk with Dr. Drix, and we will be here again with you, Queen. We will be announcing that soon. All right,
For
guys.
sure, no problem.
So
As you ready. Yeah, thanks a
we got
lot.
some
Thanks a
ones in
lot.
the chat too.
I always wanted ones in the chat for me, you know. I always wanted ones in the chat. But thanks a lot for having me, Kurt. Thanks for the platform. Thank you guys. Thank you guys for tuning in and listening, because if it was just me and Kurt talking, it still wouldn't have gotten the message across. So thank you guys for tuning in as well. And yeah, if really and truly there's anything that you want to know or anything like that, just feel free to reach out. You know, I'm a pretty laid back and approachable guy, so feel free to reach out, man.
Yeah, man. I mean, want to thank you for that as well. He is a very approachable person, so you could definitely ask him any questions. At K_Dal, what's the number behind it?
92.
At K_Dal 92. We got enough ones in the chat coming in for you, Queen. Big it yourself, man.